Hello everybody, my name's Professor Andrew Wardley. Some of you know me, but for those who do not, I'm a breast cancer medical oncologist with over 30 years of experience and over 300 peer-reviewed publications. I was involved in all of the trials that have led to major advances in breast cancer drug therapy, and I've acted as a clinical expert to NICE to ensure that these got commissioned in the NHS. One would expect with this experience I should know a lot about breast cancer, how it behaves and how it should be treated. Today I want to talk to you about the patient's right to a second opinion. It is a fact that the NHS is stretched because of many years of underfunding that have led to workforce shortages. This is particularly so in cancer medicine, where our successes in developing new treatments have greatly improved outcomes for patients and treatment tolerability, as well as the quality of life for patients both during and after treatment. Unfortunately, there are not enough specialists in the NHS to be able to tailor time and effort to support the patient on their cancer journey. I've seen some strange decisions made by non-breast cancer specialists and bad explanations that have confused patients even though the treatment advice was correct. On the flip side, I've seen some very conscientious doctors who really do their best to provide as much information to the patient as possible. This in itself can be daunting. While many clinicians promote the right to a second opinion, it's never really followed up with information about how to organise one, where to get one from, and how the process actually works. I will do a further video in the coming weeks with feedback from patients on how they found the experience from booking a consultation, through the value that it added to their treatment pathway, and how they took this forward. Doctors are expected to respect the patient's request for a second opinion, and in most cases they will do so and facilitate the referral process. Initiatives like Martha's Rule also aim to improve the access to urgent reviews when the patient's condition is deteriorating rapidly. No one can say to you as the patient that you're not allowed to have a second opinion or access to your data. Anyone who suggests this is clearly talking nonsense. If you would like to discuss your treatment options or have an explanation that you understand away from the pressures of an overstretched NHS, I will be happy to do so and give you the time to enable you to understand your situation and your options. To book an appointment, contact us at cancerservices.co.uk and the team will organise an appointment for you depending on whether it's your first visit, a repeat visit, or if you're an international patient. These can be done at a clinic or online.